I'm very glad that ADB co-host this event and provide a venue for this very exciting and important meeting. Well, as you know, ADB health sector has not been very visible for a while, but we are back. ADB is back to health. Now we are very serious in this health and social sector. And we are willing to invest in this health sector. So today I was asked to give a welcome remarks, but instead of the short welcome remarks, I've been working on this UHC issues for a while in my entire professional career. So I'd like to share with you some of my thoughts and ADB's ideas about this UHC. Well, UHC basically means ensuring access to quality healthcare without financial hardship. Okay. But unfortunately, if you look at the evidence of many Asian countries, including the Philippines, many countries, many people in those countries are facing huge out-of-pocket payment. That means many unmet need, sometimes catastrophic payment for healthcare, and as a result of and also this expenditure, there's impoverishment, like people become poor because of this illness. But you cannot achieve the UHC in a day. We are progressing toward UHC, and then in that process of progress toward UHC, we should pay attention to the people, disadvantaged people, and also, you know, like Feed Health or many countries have insurance coverage, but how many people are covered by insurance is not the only measure of success. We also should pay attention to the cost coverage or benefit coverage, how really people are protected from the high cost of healthcare. Well, as many countries have insurance, but insurance is not the only source of financing for UHC. Basically, we need public financing. It can be either tax, either public insurance, and many countries are combining this mandatory insurance contribution and public taxation, and also tax in the form of subsidy, because poor people cannot afford to pay contribution, or even many people in the informal sector, they cannot, or oftentimes they are not willing to pay contribution. So many countries combine this mandatory insurance contribution and taxation. And also some countries like Malaysia, Thailand, they mainly rely on taxation, public taxation, but they achieve UHC. So we should go beyond this insurance mechanism such that combine both insurance contribution. Even some countries have consumption tax. So the issue is that many countries cover the formal sector more or less easily. And poor people, government provide full subsidy. So the key question is how to cover the informal sector. Okay. Some countries like Thailand, they provide full subsidy for the informal sector. So that's why Thailand achieved the UHC, universal health coverage for everybody. But if you do not rely on government commitment, government financial commitments such as subsidy, taxation, budget support for this informal sector, covering the informal sector people through contribution only is very difficult. Like Vietnam, like the Philippines. If you look at China, they rapidly increased the population coverage. There is no secret because government pumped in a lot of subsidy for farmers. Okay? So please remember that the insurance contribution is important, but at the same time, government direct financial commitment or political commitment to pour more government resources like subsidy, taxation, budget support for the informal sector people. Well, as I mentioned at the very beginning, how many people are covered? How many people have an insurance card? It's not enough. Because insurance should be able to provide enough protection for cost and enough coverage of services. But we cannot cover every services, right? So here, at the minimum, we support that government or public in a country, public should have a consensus or some kind of institutional structure, what to cover, what not to cover. We need a formal process. Okay? And this formal process should be based on, for example, evidence economic evaluation, cost-benefit analysis, but that's not enough. We need, again, the value judgment, societal level value judgment. For example, whether we cover services that benefit, small benefits to larger population, or huge, big amount of benefits for small segment of the population, like rare disease, for example. We need a value judgment. Okay? So, as I mentioned, we need both evidence, but also societal value judgment. And the societal value judgment should be based on some kind of institutional policy process or consensus building. So some countries have like a tripartite committee to decide which services to cover, which is not to cover. UHC, we need a good service delivery. Because it's not just healthcare, but quality, reasonable quality of healthcare. And service provision, or so-called supply side readiness, is very important. Also, many countries have a geographic distribution issues of providers. And also, so dealing with the providers, so-called purchasing mechanism is very important. So how much to pay, how to pay providers, how to motivate providers to provide cost-effective healthcare, not to discriminate patient in practice. So dealing with providers is another very important element. Finally, the governance and accountability. Okay. UHC, of course, private sector can play an important role, but in the UHC movement, we progress toward UHC. Public financing mechanism playing a leading role, and private sector playing a complementary role. And in that case, like the Philippines, many countries have a public financing mechanism like a health insurance agency, but how to ensure the performance of the health insurance agency, how to ensure they are accountable to serve, to be responsive to the needs of the public, because UHC, basically, we want to serve the public. And also, healthcare, Central Ministry of Health cannot cover everything. As you know, there's a huge role, very important role played by local government. So here, one of the topics in this conference is communities. The role of the communities, role of the local government is also critical. In that sense, how to coordinate between local, very primary care level, or provincial government, central government is the key. Not just in Philippines, but more countries in Asia, Indonesia, India, China. So one of these local government issues, the role of local government in our effort to UHC is another key agenda for the whole, this accountability and UHC issues. Thanks again for coming to this meeting, and I wish you a very successful and exciting discussions, conversations, and meeting outcomes. Thanks a lot.